Hello, my name is Dr. Richard Cheng. Today I am going to share with you my experience of reversing coronary vascular disease with orthomolecular medicine. I will report 2 cases and also a literature review. And this is about me. That's a couple of years ago. Now, first of all, coronary artery disease are the leading cause of death worldwide, killing about 18 million people in 2019 worldwide and representing about 1/3 of all global deaths. So that's the major killer worldwide. 2/3 of these deaths are due to heart attacks and strokes, usual atherosclerosis. And United States alone spends about $320 billion a year on adult cardiovascular diseases. That doesn't include even children. So it's a major threat to our health. Now, first of all, I'm going to report 2 cases. This first case is a Mr. H. He is a 63-year-old Chinese man from Chengdu, China. He has a history of coronary artery disease, and as he's symptomatic was chest pain, the angina pectoris. He received his first CT confirmation of diagnosis back a couple of months prior to this report. The first report I didn't see. This report here showing on the left was done in August of 2020. It is a CT angiography, CTA. Basically angiogram of coronary artery disease that showed soft plaque formation and mild stenosis of in the range of 25 to 49% of the proximal portion of left anterior descending coronary artery, and also soft plaque formation and moderate stenosis in the range of 50 to 69% of the middle portion of LAD. Now, this is diagnostic, plus was his symptoms. And the other parts of the coronary diseases are fine. So these are the main findings of back 20 months ago. Now, so he came to our service after this second CT, further confirmed he realized the significance. He came to our service through word of mouth. Anyway, this is the protocol we recommended him, our orthomolecular medicine protocol. And here are some highlights. We always start with lifestyle changes. And here I want to focus on diets, low carbohydrate or intermittent ketogenic diet. That's what we recommended to him. Also with 16/8 intermittent fasting. We discussed the diets in our last presentation a couple of months ago, I remember, to the same group. And what I want to say here is that actually ketogenic diet is a low carb, high fat diet, which is the opposite of what the conventional medicine today recommends on heart diseases. Usually they recommend low fat. So that's one difference we already discussed in the past. Today I will touch base probably a little bit later on this again. Also, we advise our patients to avoid high omega-6 PUFA, like seed and vegetable oils, and supplement omega-3 fats, usually in the range of 1,000 to 4,000 milligrams daily. Now, we advise patients to use good fats. The good fats we mean by animal fats, the saturated or monosaturated fats such as butter, lard, avocado oil, or olive oil, coconut oil, or camellia oil like tea tree oil. Those are saturated or monosaturated fats. They don't have a lot of omega-6 fats. Now we consider them as good fats. Exercise. We all need to exercise, but this patient is symptomatic with chest pain after exercise, particularly after he swims, exertion. And so we advise him to stay active, but not to the degree that would cause his chest discomfort. And if possible, to the degree of sweating. Sweating is important. Also sufficient sleep and sunshine daily, that's routine. Now, in addition to the lifestyle changes, but also we recommend also molecular nutrition supplementation. This is quite critical. Now, we usually recommend a broad range vitamins and nutrients. We usually include these in a package called the total cell nutrition that includes all vitamins. Now, we focus on some high doses. Some of the vitamins we use, particularly high doses, for example, vitamin C. Usually we recommend between 10 to 15 grams a day, and also niacin and vitamin D3. We all know vitamin D3 is, low vitamin D3 is very, very prevalent. Some studies show maybe 95% of the population are deficient in vitamin D3, and vitamin K2 as well, in addition to magnesium and other vitamins and antioxidants. And we also focus on mitochondrial nutrients, including lysine, proline, all these nutrients. So one other thing very critical is that do not supplement calcium supplements, okay? And this is the best book is written by Dr. Thomas Levy on this subject, Death by Calcium. So don't take calcium supplementation, supplements, because they actually aggravates and make coronary artery disease even worse. So this is our pretty much standard protocol to most of our patients, and we may vary, a little bit based on age and disease, etc. So 8 months later, this same patient, Mr. H, repeated, did a second CTA, actually a third, but in our series, the second, at the same institution on April 16th, 2021. Now, this time, the soft plaque and the mild stenosis of the proximal portion of LAD disappeared, which is great news. The stenosis and of the middle portion of LAD significantly reduced from, it was 50 to 69%. Now it's 1 to 24%, actually 2 degrees lower. So which is pretty significant. And no other abnormalities are seen at the right coronary artery and other branches of coronary arteries. It was pretty significant. The patient at this time felt improvement in symptoms. His chest pains did not happen as frequently as used to be, and also his exercise tolerance has increased. However, he was still, suspicious, and I would too, whether this is true or not. Now, he showed me the report. I recommended him. I said, encouraged him. I said, this is showing progress. Continue the current regimen. And in the first about 8 months, even after the second CTA, he was contacting me regularly through email and messaging system, because he was quite often, having these chest pains, and I was analyzing for him, on these issues. But since the second one, actually, he didn't contact me regularly, and his symptoms were not as frequent. The third CTA, which was done about a little at the end of February 2022, just over a month ago, this was about 20 months after he started the protocol. He repeated the same coronary artery angiography, and this time there is no disease seen whatsoever. Okay, no stenosis, no soft plaques found in the left coronary arteries. And this time, he was totally convinced. And the doctor was surprised. And the patient was totally convinced this is true, that his true coronary artery disease was improving and reversing. And his symptoms all disappeared. This is a message he sent to me just a couple of months ago. He was telling me that he felt better. He's very exhilarated. He's excited, and he's exercised. He can run from the first floor all the way to the 11th floor without any chest pain or tightness. So this is truly a reversal of coronary artery disease. And he's very happy, and so am I very happy. Now, that's the first case. The second case, this is a Mr. L, a 61-year-old Chinese gentleman from Hunan province, Hunan, China. And he was found to have multiple health problems to include bilateral carotid artery plaques and stenosis, fatty liver, cholecystitis, Hashimoto's thyroiditis, and some other problems during his routine physical exam on October 2020. And he was concerned. He was also referred to me. Now, I essentially prescribed the same protocol to him. There was some differences here. The major difference is because of his Hashimoto's autoantibodies. And we know autoimmune diseases have a very tight connection to leaky gut, to our GI tract health. And part of the culprits, the causes causing leaky gut may be plant foods or the toxins in the plant foods. We know plant-based foods have high lectins, oxalates, for example, gluten. We all know about gluten in bread, in wheat products. Gluten is only one type of those lectins, and there are many other types. And even if we all know about lectins, glutens in GI symptoms, however, these can cause other problems. So we want to stay on the safe side. So usually I recommend the patients with autoimmune diseases to stay off of those plant-based foods that show high likelihood of having toxicities. I think we discussed this also in our previous lecture. I will not go into detail this time. Also, the rest of the protocol was pretty much similar. Except in autoimmune diseases, we also increase our vitamin D3 levels and niacin, that's vitamin B3, because high dose vitamin D3 has been studied in autoimmune diseases, and apparently they can be part of the protocol, which we are also including on the autoimmune disease treatment these days. 6 months later, on April 9th, 2021, Mr. L had a MRI exam of both of his carotid arteries. This time, there is no abnormalities, no plaque formation, no stenosis of the lumen seen at all. The patient was also very happy. Overall health is also improving. By the way, I didn't show here, his fatty liver and his cholecystitis is also improving. So these are the two cases of reversal and significantly improvement and reversal of cardiovascular diseases. Now, if we look at the literature, we have seen the very first report, maybe from Dr. Willis and his group back in 1954. Now, that's 70 years ago, about 70 years ago. Their study showed that vitamin C may be able to reverse atherosclerotic coronary artery disease. His protocol was, they studied basically 16 patients and divided the 16 patients into two groups, 10 men in one group, average age of 64 with coronary artery disease. And they gave them, these patients, 500 milligram vitamin C 3 times a day, okay? And the study period was 2 to 6 months. And the other 6 men with no vitamin C supplementation. They reported that 6 out of the 10 in the vitamin C group showed various degrees of regression or reduction in plaques. So that's improvement. And 3 out of 10 in the vitamin C group showed continual growth of plaque, so no improvement. And 1 in 10 in the vitamin C group showed no discernible plaque change. So 60%, 6 out of 10, that's still pretty significant. The control group of 6 men showed no regression or no change of, no improvement in plaque at all. So that was the very first that I know of vitamin C on coronary artery reversal, reverse. Back in 1990s, we know the great Dr. Linus Pauling, 2 times the Nobel Prize winner. He reported several cases of reversal of coronary artery disease with vitamin C and some other nutrients, including lysine. And one of the cases was a 62-year-old lady who showed 50% stenosis in the LAD, and 75% stenosis in the right coronary artery. After 19 months of treatment of vitamin C and lysine, the 50% LAD stenosis disappeared, and 75% stenosis in the RCA was reduced to 40%. That's actually similar to what we are finding in our case. About 19 months, 20 months, we begin to see significant reversal. Now, back in 1996, there were two scientists at the Stanford University. They reported their results of 55 coronary artery disease patients, aged between 44 and 67. Treat them with vitamin C and nutrients. And the follow-up period was about 12 months. And the marker they used was coronary artery calcium score. Some of you may know that CAC, coronary artery calcium score, is a sensitive, reliable, inexpensive, and safe measure of the calcification, or basically calcium deposits in coronary artery. That correlates very well with coronary artery disease. So CAC actually is a very good test to detect early changes in coronary artery disease. The CTA, the CT angiogram, is a little bit more invasive because you have to inject a dye, and some people may be sensitive or allergic to dye. But this is very easy. It's a very quick scan of CT, very low dose of radiation, and it's available in the United States in practically a lot of hospitals for just $100 in our local hospital right here. And so they used the CAC to follow these patients, follow the change. Within 1 year, the CAC in the control group progressed by 44%. That's natural. Every year, above age 50, that about 66% of the population would change from negative to positive. So every year we have calcium deposits in our coronary artery. Eventually they will become, some of them, actually many of them, will develop some degree of atherosclerosis. And the nutrition group that received the vitamin C showed CAC progression slowed down by 15%. So this is a relatively large study group, 55 patients, the largest that I know of, and showed this significant improvement in the CAC score. So that was 26 years ago, 1996. Unfortunately, these studies are all small in scale. However, these studies are very promising. They showed that CVD may be reversible with lifestyle change, with vitamin C and nutrition. Because after the very early slide I showed you, that the CVDs are the leading cause of deaths globally, killing about 20 million people a year. And also it's a very expensive disease in the United States alone. We spend about more than $320 billion a year, 320 billion, okay? You would expect, given the significance of these diseases, the CVDs, and also the promising results of nutrition lifestyle change, you would expect more research, more clinical studies to show whether it actually works or not. However, to my dismay, and I have to the best of my knowledge, in the last 26 years since 1992, there is no major clinical high-dose nutrition intervention studies for coronary artery disease reported. And why? Let's all figure out why. I mean, you may have your guesses, but I can tell you not off the record, but a great doctor told me that Dr. Thomas, a group of the doctors, they were organized, they raised the $3 million US dollars, tried to do continue to do such research to show whether nutrition, high-dose vitamin C and nutrition may help to reverse coronary artery disease. However, right before the clinical trial started, the clinical trial was called off because one of the cardiologists backed off. We don't know why. I assume under some pressure. So that's the current status. And let's just go over briefly the mechanisms behind. This is the anatomy of coronary artery, and we are all familiar with as physicians. So basically, you have three layers. You have intima, the innermost layer that comes directly in contact with blood, and you have the media, the central, the section, and the adventitia. Or the thing is, all the collagen is a major component of all three layers. Now, let's review about collagen a little bit. We know proteins make up probably 20–30% of our human body. So for us, we have a lot of proteins in our body, okay? Depending on muscle mass, some people may have more. But that's, we all know that what we all know. However, what we don't know probably, a lot of people probably don't pay attention to, is that collagen fibers actually make up about 1/3 of all these proteins. That's a lot of proteins. That's a lot of collagens, okay? We all know that's common sense. Vitamin C is essential and is critical in collagen synthesis. Without vitamin C or vitamin C deficiency will lead to poor collagen synthesis. We all know vitamin C deficiency causes scurvy. What is scurvy? Well, one of the basic mechanisms is because vitamin C deficiency leads to collagen synthesis deficiency. So our skin, our blood vessel walls break down. People bleed, right? So that scurvy not only can happen on your skin, it happens all over our body, okay? Collagen is the major protein, as you can see here, in our body. And all our cells, most of our cells are connected to each other. We all know that, except the blood cells, right? The red blood cell, the white blood cells, they flow freely in our blood. However, the rest of our body cells, they are all connected to each other through connective tissue. The major component of the connective tissue is collagen. So this is very critical. Now, let's see. With that in the background, is that basement. This is normal basement. Okay, this is a cross section of a depiction of a coronary artery, or of any blood vessel actually. Is that the pink one here is the endothelium, thin line, single layer of endothelial cell, and these in between, you see that between cells, actually, you have collagen, okay, connecting these tight junctions, or these junctions, linking these cells together, okay. The yellow part here is basement membrane, then you have the media adventitia, okay. Now, this is the normal basement. The hypothesis is that when you have too much toxins or oxidants, or you have not enough vitamin C in your blood, then you have a relative imbalance of the vitamin C, and therefore that leads to poor collagen synthesis. And these cells begin to sort of, the glue between the cells begin to break down. And then you have opening up between the cells, and a lot of things basically presents to our body as inflammation. And our inflammatory cells, the proteins, cholesterol, and all these things will begin to penetrate into, going between the cells and deposit into our basement membrane. This is one of the hypotheses, is that this is our body's repair mechanism. Basically, there are a lot of holes, small holes on our blood vessel wall, and our body is trying to fix it, trying to plug up the holes, okay? So that's the degeneration stage. And eventually here, because unless this process is reversed, the toxins being reduced or removed and the vitamin C is being supplemented, the wall structure is restored to normal. Otherwise, this progress continues, right? Because most people don't know this. So they continue to eat unhealthy foods, the toxin overload, and they continue not to take enough vitamin, and particularly vitamin C. So this progress is a continuous, persistent process, and that's called the proliferation stage of the coronary of atherosclerosis. So basically, eventually, it forms a plaque, and the lumen will become narrow and narrow eventually. It's like a scar formation, actually. It's very similar to the scar formation that you can see on your skin. And then eventually that can occlude the lumen. So that's the basic hypothesis mechanism. Now, I think I have shown you this picture before too, is the oxidative stress. Oxidative stress is common in practically every chronic disease that I know of, that I have searched for. If you search Medline, I mean the PubMed, the world's largest medical library. So look for oxidative stress in any sort of the chronic diseases. You will find elevation of chronic disease in practically every chronic disease that I have searched. And believe me, I've searched a lot over the past more than 10 years, okay? So oxidative stress is also a key mechanism in cardiovascular diseases. If you search for, literature, you will find coronary artery disease is an inflammatory disease, okay? Cholesterol elevation is only a superficial sign, it's only a reflection, not the cause. So anyway, long story short, the yellow ones here are oxidants. These including smoking, heavy metal, chemicals, pollution, radiation, processed foods, virus. We are still in the middle of a COVID-19 virus. Metabolism can also produce a lot of oxidants. These factors will increase the free radicals or increase the oxidative stress. The green ones down here, the unprocessed foods, the vitamins, the flavonoid and antioxidants, all these other will reduce the oxidative stress. So the balance in between, or the lack thereof, the imbalance, will either increase reactive oxygen species or reduce reactive oxygen species. The increased ROS will cause oxidative damage of DNA or protein or lipid, okay, or the three major classes of our structural molecules. And these can cause apoptosis, necrosis, or cell cancer, carcinogenesis. So oxidative stress is the central pathway, central mechanism of various factors that may ultimately affect our cell health. So in this elegant little symbol, my Cynthia, my assistant, did, showed the defined balance. You need a balance between the oxidants and the antioxidants. So balance here is the foundation of health, okay? And I think we discussed briefly before, is that today's world, way too many oxidants, toxins in our environment, in our water, in our food, way more than decades ago, let alone hundreds or 10,000 or thousands of years ago. And also in our food, we begin to eat more and more processed foods and are low or deficient of vitamins and nutrients. And I think I showed you earlier also in our last presentation, is that, for example, one example, omega-6 fats ratio to omega-3 normally should be about 1:1 or 4:1 in the pre-agricultural age, before all the industrialization things happen, before agriculture happened, is about 1:1. However, right now the ratio is at least 18:1, or maybe I have seen even as high as 50:1. Okay. Now we know omega-6 fats are pro-inflammatory, so high omega-6 will cause inflammation. No wonder we have so many inflammatory diseases these days. So here is my summary. Basically, on the little picture here, I showed you we need to, when we approach health and disease, we need to. The current conventional medicine really is, in my view, incomplete and even flawed, is that it doesn't have the integral view, holistic view. So in my view, we need to have integrative view, and we have to have a natural view and a balanced view. I think these are three major pillars of health and medicine. And so lifestyle, diet, nutrition, okay, these are all part of our protocols. Also, the way I view health, that don't focus on, again, our conventional medicine makes us to only focus on, let's say, for example, cholesterol, ignoring everything else, right? That's very problematic. And that's why no one, I repeat, no one of the chronic diseases with the current medicine can be cured or reversed. But using this approach, we have seen reversal of practically all chronic diseases, yes, including cancer, heart disease, autoimmune disease, let alone diabetes actually is relatively easy, high cholesterol, gout, all these diseases. Autoimmune diseases are very common. I mean, reversible. So we manage many patients with psoriasis, with eczema or various, those are actually not that hard to treat. But here is my view of health at 3 different levels. We not only need to look at the biochemistry, nutrition, okay, toxin. Also, we need to look at the higher level, the physiology level. Why? That's what I meant by hormonal balance, because you need a hormonal and neuron regulation, balance, connection of all parts and molecules. So hormonal balance is also a major part of our approach, which I will not go into detail this time. So finally, well, thank you very much, Dr. Bagley, for the invitation. And also I want to express my special thank you to Dr. Atsuo Yanagisawa, Andrew Sao, Dr. Thomas Levy, and many others on the board of International Society of Orthomolecular Medicine. They really taught me true medicine, including Dr. Barley. And I wish I knew orthomolecular medicine earlier, but I'm glad never too late. Right? Thank you again.